Ben, thanks for joining us today. It's great to get you back and to hear about your experience with superior canal dehiscence surgery, particularly what it's like after the surgery and recovering once you've left the hospital. Just remind us, you've had surgery on the left side. How many months ago now?
3.5 months.
So about 3.5 months out.
4 months.
And you also still, though, have dehiscence on the right side.
I do.
So you're potentially contemplating having surgery on that side down the road.
Yes.
So tell us, how did you get to the point of having surgery on your left ear? What symptoms did you have? And
For me, most of the symptoms were auditory, hyperacusis and autophony, and I had some visual issues. So whenever any loud sounds were introduced, including sounds from my own body, breathing, heartbeat, all of that stuff, my vision would shake on me. And it was getting worse and worse and more pervasive, to the point that it was just kind of uncomfortable all the time.
Right.
Like it was getting harder and harder to deal with on a day in, day out basis. And that was without throwing things in like talking.
Right.
Or moving around a lot,
which is a real problem
yeah,
for what you
yes,
do,
it's
right?
it's kind of a challenge. So it's a challenge for anybody.
You actually had to change your life.
I did.
because of
I
this,
did.
right?
I act. I went to school for acting. Stage work became impossible. Singing became impossible. The sound of my own voice was just flat out. It was too loud. I couldn't deal with that anymore. I couldn't hear my scene partners. I couldn't hear the orchestra. I couldn't hear anything. The left side was worse, significantly worse than the right side. I knew I had it in both ears, but that was much louder to me at the time.
So it's been about 3.5 months since we fixed your left ear, and how has that changed things?
It's hard to believe how much it's changed things. The difference in the left side is astounding. I didn't even know what normal was supposed to sound like until I woke up after the surgery, and suddenly all of the auditory issues on this side, it was like they were just gone. I couldn't hear my heartbeat on that side. I couldn't hear my eyes moving on that side. Also interesting was how loud everything on the right sounded at that point, because of the fact that I still had it over there. And I know we had talked about that possibility, that when you change the baseline, it can make the side that hasn't been operated on, it can make it feel louder because you have a frame of reference now. And that's exactly what happened.
Walk us through a little bit, what was it like immediately going home from the surgery?
The things that you take for granted on a daily basis, just riding in a car, moving around, suddenly become significantly more challenging immediately after the surgery, because your vision is sort of shifting or sliding.
Right, so we plug the superior canal, so when you move your head in that plane,
everything sort of jostles around on you. So you end up you pay a lot more attention to just basic motions.
you had to do some physical therapy, some vestibular
Absolutely,
physical therapy.
that was huge.
When did you start that?
Physical therapy started about 2 weeks after the surgery.
And how intensively did you have to do it? What was involved?
That was multiple times a week. In the beginning, I was doing it essentially as much as I could, and we would work on specific ranges of motion. We would focus on things like turning your head certain ways, and the more you did it, the less of a visual impact you would have.
But you're doing this with your eyes focused on a target?
Yes, yes. One of the ones we did in the beginning is you would have a dot or a letter, and you'd have it a distance away from you, and you'd sort of focus on it, and then you'd turn your head and try and track it, and see how long you could do that. You'd do it for a set number of beats, and then you'd slowly try and increase the speed with which you could do that. The more of that you did, the more stable things became. It gradually improved the longer you went through with the therapy. The most reassuring thing with the physical therapy was that I definitely was seeing steady improvement the more of the exercises I did. There was a huge benefit to doing that.
We tell people plan to take 6 weeks off after the surgery because it's going to take time to do all that physical therapy and get the vision stable again. Was that a realistic
For me, yes,
expectation?
that was definitely accurate. I felt close to functionally normal, probably at about the 5-week or so mark. My vision had sort of readjusted to the point that I could do a lot of those things that we take for granted day in and day out, and I could do them without feeling like I was going to tip over or that there was a whole lot of balance instability or visual instability. And the 6-week mark, I think was an excellent point for me, because at that point I had recovered enough that I was starting to get antsy about getting back into doing normal things again.
Did you have to make accommodations when you went back to work?
I did. So many things became an active process as opposed to passive processes after the surgery, especially for the first several weeks, even up through that 6-week point where you're just keeping everything stable again, and stuff that you would just do without even thinking about, like bending over and picking something up off the ground. You had to actively realize, okay, I'm gonna have to do this. There are these consequences that could happen. The more you did it, the better things got, but you did sort of have to play it safe. You had to be careful. I kept a cane with me for a while through the physical therapy sessions and through the initial weeks back at work, just till I was sort of comfortable in the space again and sure that I wasn't going to have any issues.
Now you've got some younger boys at home, right?
I do. One of the challenges that you run into after the surgery is fast motion. Tracking fast motion can be a bit of a difficult thing.
How old are your boys?
They are 12, 11, and almost 8.
So there's a lot of fast motion.
There is a lot of fast motion. They run around a lot, and they try to be quiet. They definitely made an effort, and I was very proud and thankful of that. But as boys, that was a challenge for them at times.
And we tell you not to do any heavy lifting for the 6
Correct.
weeks.
Yes. So
that
was
must be
also
hard too.
that was also challenging. Trying to interact with them without actually doing any heavy lifting. That was a relief as far as getting back to things being normal, starting to be able to pick up things that were heavier than a gallon of milk. Because right after the surgery, anything that felt like it was creating pressure up here, even something as simple as blowing your nose, you could feel it in the surgery side.
Right.
And that sensation lessened over time. You still had to be careful not to push yourself too hard, because you might feel as though everything was getting close to normal again, and then you may go and try to pick something up, and lo and behold, you feel the pressure right away, and it's like, okay, I need to slow things down.
And we had a little struggle in your case with headaches after surgery.
Yes, I had what turned out to be some really severe migraines for the first, I guess, 36 hours, 48 hours immediately after the surgery, which complicated matters when it came to the initial recovery process. There was a lot of nausea involved, typical migraine type symptoms, just very extreme. And once we came to the conclusion, I think it was sometime on the second day, I figured out that I was extremely light sensitive.
Right. And we'd had a CAT scan that was fine.
Yes, we had done a second CAT scan to make sure everything was okay, and everything was okay. Once we realized the light sensitivity thing, that sort of led us down the migraine road, and as soon as we figured that out, within hours, things started to get better as we treated the migraines. The surgery site itself didn't really hurt all that much. I honestly don't know what I expected, but being able to treat it with just Tylenol was really surprising. Even that pain, which was relatively dull, went away relatively quickly.
Have you had trouble with migraines since then?
No more than I normally did prior. And prior to the surgery, a lot of that was sound.
Right.
The more sound that I would be exposed to, either from myself, my body making noise, or from external sounds, that could tend to lead me to having migraines. So I still have that to a degree with the right side still having the SCDS.
It's an interesting point. A lot of our patients report that they get migraines, and we struggle on the diagnostic side because migraine can cause vertigo, and it's much more common than superior canal dehiscence. Can you speak to how did you differentiate between what was clearly SCDS symptoms and what were migraines?
With the migraines, for me, almost always light sensitive. So when I would pick up that I was having light sensitivity issues, I could almost be certain that it was migraine related.
Can you speak to what might your fears be about surgery for the second side?
So I'm very hopeful about the right side surgery. I know that the therapy side of things is going to be more challenging with the second surgery. But I know that when I have the surgery on the other side, that I'll be relying on the side that was fixed already, and that it's going to present more challenges. The range of motion that's going to be affected is going to be increased. There's no getting around it. Right. So I know I'm in for a longer road with the physical therapy on the other side. But having already done the physical therapy, and having seen how well it helps, how much it works, I'm confident that it's the kind of thing that I can work through.
Right. So just to wrap up, Ben, what would you tell other patients with superior canal dehiscence syndrome who are considering this surgery?
Encountering the team here at Hopkins was huge for us because it's a fairly rare condition. You'll go to doctors, the doctors won't necessarily know what it is, what's going on with it. I myself, I was misdiagnosed initially. After the course of an additional year and a half, they figured out that no, what they originally thought it was, that's not the case. It's actually SCDS.
What did they think it was initially?
Initially, it was a patchless eustachian tube. Because of the autophony symptoms, that's what they initially thought was going on. And they made some recommendations about things I could do to try and improve that. I did all of those things. The condition didn't improve at all. When I realized that I could hear my eyes move, and then I went back to the doctors and told them about that, that was kind of the thing that they were like, okay, it may actually be this other thing. We're going to do some additional tests. They did the additional tests and figured out that it was SCDS. They very much stressed the severity of the options that were available, that these are very, very extreme surgeries that would need to be done if you want to have it corrected, that there really are no easy options when approaching this. And I think for anybody who's got the condition, hearing that kind of thing is incredibly hard.
Yeah. In retrospect, did you feel like it was an extreme surgery?
After having had it, and never having had any major surgery of any kind prior to that, it feels like the kind of thing that, especially here, coming here, everyone had such a handle on it. It seemed like the kind of thing that any question we came up with, anything we had to ask about the surgery, people could answer immediately. Having a situation where you don't get a lot of that with this kind of condition, no matter who you're talking to, when you finally find somebody that you can talk to about it, and they can answer all your questions, and they do have confidence in the repair, it's really, really reassuring. So I would say to anybody who is living with the condition, I would definitely recommend finding experienced doctors like the team here at Hopkins to talk to about it, because there are options out there. It does feel like a major thing when you're going to do it. It is a major thing. There's a lot of logistics involved, getting everything organized, planning out your therapy, making sure, if you have kids, making sure that everything is covered, that you have people there to help. Getting all of that organized is a huge challenge, but it's all doable.
Well, it's very gratifying to be able to help patients like you, Ben, and I really, really appreciate your sharing this time and your experience with us, and I look forward to helping with the right side when you decide it's time to do it.
Absolutely. Thank you, Dr. Carey.